Hi, hello, welcome to Future Nerds YouTube channel. So please subscribe and support our YouTube channel. So let's start today video. So first question, what is the term for a device used to take place of missing body part? So the term used, so options are pronation, abduction, external rotation, prosthesis. So the right answer is prosthesis, option D. Next, when a client has left sided weakness, what part of sweater is put on first? So the patient is having left sided weakness. Okay, so the patient is having left sided weakness. What part of sweater is put on the first? So the options are both sleeve, left sleeve, client's choice, right sleeve. So the correct options left sleeve, because the left sided is the weakness part. So next, it is appropriate for a nurse to aid to share the information regarding client's status with options anyone the nurse aid sees fit. Option B, the client's family members, the client's roommate, the staff on the next shift. So she has to share the information regarding client status with the staff on the next shift. Option D. Next, when helping a client who is recovering from a stroke to walk, the nurse aide should assist the patient which is having stroke. So the options are on the client's stronger side, on the client's weak side, from behind the client with a wheelchair. So the correct options is on the client's weaker side. Next, the nurse aide is caring for a client who is agitated. The nurse aide should speak loudly so the client can hear instructions, ask to reimagine the care of this client, talk in a slow, calm, and reassuring manner, tell the client to be quiet. So options is option C. She has to talk in a slow, calm, and reassuring manner. Next, the purpose for padding side rails on the client's bed is to options use them as a restraint, have a place to connect the call signal, protect the client from injury, keep the client warm. So the basic purpose for padding side rails is to protect the client from injury. Option C. Next, exercises that move each muscle and joint is called options adduction, range of motion, abduction, rotation. So the correct answer is range of motion, ROM. So which is the exercise that move each muscle and joint. So next, how can the nurse aid best help a client who is not accepting a loss? Options leave the client alone, convince the client to accept the loss, encourage the client to talk, discourage individual activity. So the most appropriate answer for this question is encourage the client to talk. Option C. So next, the Heimlich maneuver abdominal thrust is used for a client who has options bloody nose, blocked airway, fallen out of bed, impaired eyesight. So the correct answer is a blocked airway. So for blocked airway, they will use Heimlich maneuver in bracket abdominal thrust procedure. So next, to best communicate with a client who is totally deaf, the nurse aide should options smile frequently and speak loudly, smile often and talk rapidly, avoid eye contact, write out information. So the client which is totally deaf, the nurse has to write out information. Option D. Next, the nurse aide is asked by a confused client what day it is. The nurse aide should options explain the memory loss is natural and date is not important. Ignore the request, point to the date on a calendar and say the date, provide the date and then test the client later. So the client which is who is confused the what day it is, then the nurse should point the date on a calendar and say the date. Option C. Next, to avoid to avoid pulling the catheter when turning a male client, the catheter tube must be taped to the clients. Options: bedsheet, upper thigh, bed frame, hip. So options is upper thigh. Next, a nurse aide can assist clients with their spiritual needs by options: taking clients to the nurse aide's church, allowing clients to talk about their beliefs, avoiding any religious discussions, talking about the nurse one's spiritual beliefs. So the correct option is allowing clients to talk about their beliefs. So next, a nurse aide must wear gloves when feeding a client, doing perineal care, giving a back rub, doing range of motion. So she must wear gloves in doing perineal care. So next question, when getting ready to dress a client, the nurse aide should. So when getting ready to dress a client, options: get the first clothes the nurse aide can reach the in the closet, give the client a choice of what to wear, use the clothes the client wore the day before, choose clothes that the nurse aide personally likes. So the correct option is give the client choice of what to wear. Next, if the nurse discovers fire in a client's room, the first thing do is call the nurse in charge, try to put out the fire, open a window, remove the client. So the priority thing is to do to remove the client. Next, in order to communicate clearly with a client who has hearing loss, the nurse aide should options: speak in a high pitched tone of voice, stand behind the client when speaking, speak in a loud and slow manner, look directly at the client when speaking. So option D is the correct options. She has to look directly at the client. Next, which of the following stages of dying is usually the final stage? So they are asking about the stages of dying. Options: anger, acceptance, bargaining, depression. So acceptance is the right answer. If a client says God is punishing me or why me, how should the nurse aide respond? Options: reply God doesn't punish people, listen quietly, ignore the client, make jokes. So the options will be listen quietly. Next, the role of the ombudsman is to run a group of nursing homes, work with the nursing home to protect clients' rights, control the nursing home budget, prepare classes that nurse aides to take to learn about client hygiene. So the options is B is the correct answer. Next, a nurse who is active in her church is assigned to a care for a client who is not a member of any religious group. The nurse aide should answer. So the options are: help the client understand the nurse aide's faith, tell the client that it is important for the client to join some church, even if it is not the nurse aid church. Option C, respect the client's belief and avoid starting religious discussions. Option D, arrange to have the nurse aid clergyman visit the client. So the options C is correct answer. So next, the nurse aide notices that a client's mail has been delivered to the client's room. The nurse aide should options open the mail and leave it on the client's table, open the mail and read it to the client, read the mail to the make sure it doesn't contain upsetting news, give the client the unopened mail and offer help as needed. Option D is the correct answer. Which of the following is the correct measurement of urinary output? So options 40, 300 cc, 2 cups, 1 quart. So the option is the 300 cc, option B. Next, the client offers a nurse a $20 bill as a thank you for all that the nurse aide has done. The nurse aide should take the money so as not to offend the client, politely refuse the money, take the money and buy something for the floor, ask the nurse in charge what to do. So when the client is offering you some amount of dollar or currency, so you should do politely refuse the money. So option B is the right answer. All of the following situations are examples of abuse or neglect except options restraining a client according to a physician's order, leaving a client alone in bathtub, threatening to withhold a client's meals, leaving a client in a wet and soiled bed. Option A is the correct answer. Restraining a client according to a physician's order. So friends, we have come to the end of the video. So we'll discuss some multiple choice questions in the next video for your upcoming AIIMS NORCET 6 and also nursing officers and staff nurse exams. So please subscribe and support our YouTube channel. So thank you.